Hi, I'm Dr. Ganesh Nagarajan. I'm the Director of GI and HPB Cancers at the Nanavati Max Institute of Cancer Care. Today, this being the World Colorectal Cancer Month, we are addressing a few questions by our patients, and we'll be happy to take these questions and answer their queries.
So my question was, can a young person also get colorectal cancer?
Today, in fact, in colorectal cancers, we are seeing almost 1 in 5 patients who walk through my OPD are patients less than the age of 40. This is a fairly alarming trend that we've noticed globally, and the same trend has caught on in India as well. There are various factors for young patients getting colorectal cancers. Apart from genetic predisposition that some families have, there could also be a lot of environmental influences, a lot of dietary changes. We are rapidly adopting a very unhealthy westernized lifestyle where our diet is full of processed foods and junk foods, and this is a fairly common reason why we are seeing the shift in trend to younger patients. So I think that's something that we need to be aware of. Young patients need to be aware that anyone with symptoms like bleeding in stool or alteration in bowel habits is not to be taken lightly, and if it's persistent for a fair bit of time, it should not be just attributed to piles or hemorrhoids. They should consult a doctor and get investigated with a colonoscopy.
Sir, my relative underwent surgery for the rectal cancer. Can the cancer spread to the liver?
So today, more than ever before, we are able to cure or potentially cure liver metastasis. Liver metastasis basically means that a spread of colon or rectal cancers into the liver. While liver metastasis means bad news in lot of other cancers like gastric cancers or pancreatic cancers where not much is possible except palliation or palliative chemotherapy. Today in colorectal cancers, with a combination of chemotherapy and radical surgeries, we are able to treat a vast number of patients with colorectal metastasis and help them completely get back to normal lives, and many of them survive for 5 years and beyond. And I think if treated the right way, many of these patients can really have a fairly long life.
So my query is, what would be preferable for colorectal cancer, traditional surgery or robotic surgery?
So today for rectal cancers especially, I think minimal access surgery or robotic surgery has caught on in a big way. For colorectal surgeries, across the board today in worldwide, a lot of surgeries are done minimal access, where we don't need a big cut, and with small incisions and small 8mm cuts, the robotic instruments are put in and the entire surgery is performed. We do a fair bit of robotic surgeries for rectal cancers, and we found that patients have really benefited a lot. A is that the duration of stay is much lesser. By the 3rd day, like 4th day, they're ready to go home. The pain is significantly less. They start oral intake much earlier than open surgeries. And we also find that because of the magnification and the improved vision with robotics, we are able to actually preserve nerves better. Their functions, bladder functions or sexual functions are much better after these ultra-low rectal surgeries. Patient selection is very important. We have to select the right surgery for the right patient for us to give him the best benefit. So to summarize, I think awareness of colorectal cancer is very important. It's a cancer that's growing in India rapidly, and it is something that can be completely cured. It is one of the cancers which has an excellent prognosis, and seek help as soon as possible so that we can help you get back to absolutely normal lives. Thank you.